Esa wa kwa bakese pa edebadwe brem dwumadi ne so medino eye Elaine Ato menina na otu da kon enedi dwumadi hu chiame edu se ye beka yapomudin hu ensem esan se ene no eye World Tuberculosis Day eye international eye the whole wide world 24th of March 2023. Tuberculosis was found out in 1888. Years ago ena omuhu se tuberculosis no ne ho efare by any enti yebe kan ho asem ehu de enti a etimi ha adwene de enti a etimi ekoye kronkron ewo nipaduane mu a etu ase a entimi entu ase ene no yenya enuaba fefe oba fefe tuntum kama na tokotoko te se me a Mabel Tete Efri eye technical officer ono no technical officer edema tuberculosis control program Ghana Health Service thema eda eye World Tuberculosis Day no enedie eye yes we can end tuberculosis oba pa me pacho akwa abakese pa de ba ye fidi kese so me pacho efie boko de ye da yeso ase nyame adom. Yes we can end tuberculosis. What is tuberculosis day? Obeka brofo na obeka chi. Obeka brofo. Okay. And that means what you kakra uchi mo. Okay. What is tuberculosis day?
Tuberculosis Day is a day that has been set aside to commemorate when the bacteria was discovered by Dr. Robert Koch, and that gave researchers the opportunity to identify medications to be able to combat the disease. And so on that 24th day, worldwide is set aside to commemorate the day and to educate the whole population about the TB disease.
Is there a rationale behind the fact that it is called tuberculosis and then the theme, yes we can? Is there a rationale?
Yes. The rationale is that we want to end TB by 2030. And so in a few years to 2030, all efforts are geared towards fighting and then ending TB in 2030. Hence the theme, yes, we can end TB.
Yes, we can end TB. Now, in 2023, what is the main focus that the Ghana Health Service is standing or sitting on to help cure or eradicate tuberculosis in all?
Okay. So in 2023, the aim of the Ghana Health Service is to find all the missing cases so that we are able to end TB by the 2030 date that has been set. In that, as of now, we are finding about 36% of the estimated cases in country. Hence, we have a gap of about 65% cases to find. And so 2023 and beyond, we are putting all efforts together to educate the population, to create more awareness on the disease so that we are able to pick each and every one TB case. Then we can reduce the infection and then be able to find all the missing cases.
So that is going to be the main focus for 2023.
To bridge the gap and to find all the missing cases so that we can end TB by 2030.
By 2030, 2023 and beyond, when we say in Kwada, are very infected with tuberculosis,
as of now, about 5% of the cases that we detect in country are children. And this has been increasing over the years, and now we are at 5%. Oh, yeah. And also, finding TB amongst children is quite difficult because, you know, children are such that they cannot complain exactly of what is wrong with them. And so a lot more efforts have to go into diagnosing and examining them to be able to find TB among children. And I mean, in this era, when our mothers have to go to work after, and then we leave our children with caretakers and all, we do not know the status. Okay, and so our children also get infected towards coming into contact with people with the disease. Probably they don't even know they have the infection. And so all efforts are also geared to find the adults, and then we can get to
The children.
Yes.
Right. Is there any prevention for protection against the TB?
Yes. So there is prevention for TB for the vulnerable groups. When I say vulnerable groups, I mean, one, contacts of people who are sick of the disease. As we all know, TB is an infectious disease, and it can be spread from one person to the other. And so once a TB case is diagnosed, contact tracing is conducted so that persons that are living very close contact with the patient are given medication to reduce the infection and to prevent them from getting the disease. Okay, so that's one preventive measure. Also, for people that have very low immunity, like persons living with HIV, okay, we are given prophylaxis also to prevent them from developing the disease. Yeah. Yes. So these are, and then children also in close contact with positive TB cases are also given prophylaxis to prevent them from developing the disease. So these are the groups that...
So have there been cases where you're not able to trace any of these people who have the weak immune system, who may have contracted the disease, especially, forgive me for using this, the rural areas who are truly suffering, and the children happen to contract the disease? How do you go about those ones?
Okay. So thankfully, in the health sector, we have very committed health workers, even at the rural settings, in the various sub-districts. And so once a case is detected, they liaise with volunteers within the communities and go to the homes of all positive patients and then educate the household, contact screening, so that those that have symptoms that are suggestive or presumptive of TB, a test is conducted for them. And then once they are not positive, then because of their close proximity, prophylaxis is offered for the protection.
Let me chip this in before. Is there an openness to learn when the education is being passed on to the masses? Is there an openness, like omusuro say, oh we Arabia yadiatna once or the say normal wabo? Do you get that? And is there a barrier? How do you correlate to that?
Yes, often there is that barrier, and there is that lack of knowledge. So our health workers and the health promoters also know the strategies to use to sort of alleviate the fears of the community folks, and also educate them well enough such that they accept, I mean, what they say. And one evidence is that once they see their relative getting better on the medication, then they now understand that, oh yes, this disease is not so deadly that it can be cured. And so yes, they begin to learn or open up to the knowledge that is impacted onto them.
That's beautiful. Now, is TB a threat to our society?
Oh yes, TB is a threat.
How?
So we are estimated to have about 45,000 TB cases in country. Like I said earlier, we are doing currently about 16,000 cases a year. Okay, so imagine we are not treating 16,000 cases a year, and every one of them is infecting all the people they are in contact with. That is a lot of threats. And thankfully, we are finding these numbers and we are able to treat them. But like I said, once the gap, that we are not able to find all the estimated cases, it means that infection is still ongoing. Okay, and so that's why we use some of these strategies to try and educate the populace, so that once you identify the symptoms of the TB disease, quickly you approach any health facility, and then once you are screened and tested and you are found to have the disease, you are quickly put on treatment.
Exactly. What's the severity of the TB or the tuberculosis case in Ghana?
Okay, So we annually detect about 16,000 cases, and then it is estimated that about 30 people die daily of TB without treatment. Without treatment.
Oh, wow.
So among the persons that we treat, I mean, due to other comorbidities and all, we have 10% dying, even amongst the 16,000 persons that we identified daily. Some of the reasons for the death could be attributed to late reporting to the health facilities because of lack of knowledge. Exactly. So we advocate that all health facilities conduct screening of persons that come to access any kind of health service, so that through that we are able to pick out TB cases early enough so that they don't progress to the very severe stages of the disease, so that they can be treated early.
Okay, let's go to stigmatization. What are some of the potential problems that a patient will face from family, from friends, from people he or she knows?
Okay. So because of the notion of the disease, mostly patients will not want to disclose or not want close contact to know of their condition, all because of the stigma attached to it, because of our perception of how the disease comes about.
It's HIV and AIDS.
It's HIV and AIDS in terms of the perception or how you get it. And so there is a lot of stigma. So a patient may not want the immediate family to know, because they might neglect or not come close to them at a time when they are sick and they really need them. Even at the workplace, once you are coughing and then, I mean, you openly say you have TB, then everybody will begin, will begin to shun away from you. And this leads to a lot of stigma for the patient, and it affects even how they perform on treatment.
Because we are okay, Mecca questions too, Eddie Abom. How long does it take to treat TB? And then, can we use herbal medicine to cure tuberculosis? Thirdly, your advice to the masses, to the public, on tuberculosis.
Okay. So, TB treatment takes 6 months to treat. Adhere to your treatment for 6 months. And then, within the process, we conduct various tests to ensure that, yes, you are converting from being positive to negative, and that you are fairly well. Some people, or most at times, after about 2 weeks of the medication, the bacteria load is lowered so much so that you are very well, and you are feeling like you are fine and you are okay. Exactly. But then these bacteria can be dormant for a while and they can come up again. And so the TB treatment lasts for 6 months. And then you end, and at the end, we conduct a laboratory examination and ensure that you are negative, and then we declare you cured. Okay. For herbal medicine, as of now, there is no known evidence of herbal medicine curing the disease. So for Ghana Health Service, we do not have any herbal medicine that cures the disease. Yes.
Now, Madam Abel, I would like your advice to the masses.
Okay. So my advice to the general public is that on World Tuberculosis Day, we are reminding all of us the TB disease exists and it's real. And so the symptoms of the disease, once you start exhibiting the symptoms of the disease, you quickly get to a health facility close to you for you to be screened and examined, so that we rule out the disease. Then we know that probably your cough is due to something else. So the symptoms of the disease include cough, fever, weight loss, night sweats, drenching night sweats. Yes. So these are the classical signs that the clinicians at the hospital will identify. And then once you meet these criteria or these symptoms, a screening will be conducted. And then once you are positive, TB is curable and treatment is free.
It's free. Treatment is actually free.
Treatment is
in
free.
every hospital, private or local?
In every hospital.
Government hospital is free. Private hospital, it is free.
Mission hospitals,
they are free.
Treatment and diagnosis of TB is free.
Madam Mabel Tete, Yabeda Technical National Officer at the Tuberculosis Control Program, Ghana Health Service, and a day or no, and any ever to drink more far tuberculosis, and then so a World Tuberculosis Day, 24th of March 2023, no, and unti, and I to Edia Sheda. And the theme I can say, yes, we can get rid of tuberculosis by 2030. Dear Okane said, TB is curable. 6 months, Saunya TB, tuberculosis. Yarea uptimi ebowa ewa kranko a entimi enkono se utimi ehu se wenye bia ubedwane akọ any mission hospital, local government hospital, CHIP compound bia ubehu bia private hospital bia ubehu bia no eye free yenju kapre so mo be yen hwehwemu ama wehu se wenya yare ni bi so mo sa ebe ma wonduro etimi atu yare na se no ni nyina no according to Ghana Health Service Mabel Tete ena ete ka wo se wontua kapre kra enu nti se utimi hu se woda na jona enfifre bi ete enfifre bone ete etoato aso a eno no eye sign se wenya high fever bi anu odin pa eno no eye sign se obowa ekranko bi a entimi enko chest cough ni nyina no eye sign enti dwane na call hospital bia eben wo na omtimi enye hwehwemu ne ehu se wenya bia na yetimi tu ase de amawo na mo nso ase bia obinya bi na otimi epemuka se yare a me komuni na se dia ohawa me femuni na mutimi edwane efri ne nchen no a odo no wontimi emfa entete ensa ne yare no e wo se mutimi ejai sign the sign nanso se wotimi num ni nro na o dedicate ne life e de ma ni nduro say 6 months ni nyina no wo no mennuo na obetime to ase ekra na by 2030 no nyame adom tuberculosis will be a thing of the past in our country Ghana. Ye try ho ye free ho no mo edika na no to da ko e na ebe to aso.